Hello and welcome to the Answers for Cancers podcast. Today we're going to be talking about the hormone therapy drug tamoxifen. We'll be going through what tamoxifen is and how it works in the body, some of the most common side effects and how you can manage these side effects, and also how to take your tamoxifen. So we might start with what is tamoxifen and how it works.
Yes, so tamoxifen is a medication used to treat breast cancer. It's called a selective estrogen receptor modulator because it works by blocking the effects of estrogen in the body. So breast cancer cells can sometimes grow in response to estrogen, which is a hormone that is naturally produced in the body. Tamoxifen attaches to the estrogen receptors on the breast cancer cells, preventing estrogen from binding to the cells and stimulating their growth. By blocking the effects of estrogen, tamoxifen can slow down or even stop the growth of breast cancer cells.
Great, so we might go into some of the most common side effects and how we can help manage these when we're taking tamoxifen.
Yeah, absolutely. So hot flushes can be a side effect of tamoxifen. So they are a sudden feeling of warmth, often accompanied by sweating or flushing of the skin. So some tips for managing hot flushes include: you can stay cool by wearing loose, lightweight clothing and using a fan or air conditioner to help regulate your body temperature if required. Wearing clothes that are made of natural fabrics such as cotton that you can remove easily. Using cotton bed sheets and having layers of bedding that you can remove easily, and also staying hydrated, drinking plenty of water and avoiding caffeine and alcohol, which can sometimes worsen hot flushes. It's important to talk to your doctor about hot flushes or side effects that you're experiencing while taking tamoxifen. They can provide you with more specific advice and may recommend additional treatments or medications that can help manage your symptoms. So something else that can be seen with tamoxifen can be changes to the skin. So if you're experiencing skin changes while taking tamoxifen, there are several tips and tricks that you can do to help manage these symptoms. So it's important to keep your skin moisturized. Dry skin is a common side effect of tamoxifen, so it's important to keep your skin moisturized. Use a fragrance-free moisturizer and avoid very hot showers or very hot baths that can further dry out your skin. Try to avoid irritants, so such as harsh soaps, deodorants and other products that can irritate your skin, and stick to gentle fragrance-free products. It's very important to protect your skin from the sun. Tamoxifen can make your skin more sensitive to the sun, so there should be a broad spectrum sun cream used, and this should be at least factor 30 whenever you go outside. Talk to your healthcare provider if your skin changes are very severe or affecting your quality of life. It's very important to talk to your healthcare provider. They might be able to adjust your medication or recommend additional treatments that might help with your symptoms. So another thing that we can see with tamoxifen can be joint stiffness or joint pain. So tamoxifen can cause joint pain and stiffness, particularly in the hands, wrists and knees. So gentle exercise such as walking or swimming can help reduce joint pain and stiffness. If you're experiencing pain, please do speak to your treating team, who may be able to prescribe medication to help with the pain. So fatigue can be a common side effect of tamoxifen, and it can make it difficult to carry out some daily activities. Getting enough rest is extremely important. Eating a healthy diet and staying hydrated can also help manage your fatigue. And also the Answers for Cancers have a very beneficial podcast on fatigue with Dr. Deirdre Connolly, where she talks through some tips and tricks. And you'll be able to find that podcast in the practical information section of the app. So mood changes can be experienced while you're taking tamoxifen, such as depression, anxiety or irritability. It's important to speak to your healthcare provider, as they may be able to recommend speaking to a professional that can help with these mood changes. It can be difficult sometimes because a diagnosis can bring around mood changes and a feeling of low mood. So it's important to speak to your healthcare professional, that they can help you differentiate between a normal feeling of low mood associated with a diagnosis or mood changes associated with hormone therapy. Womb cancer is a very rare side effect of tamoxifen, but it's very important to mention. So tamoxifen can be associated with an increased risk of developing endometrial cancer, also known as womb cancer, in some women. This is because tamoxifen can act as an estrogen antagonist in the uterus, which means it can stimulate the growth of the uterine lining. However, it's important to note that the overall risk of endometrial cancer with tamoxifen is still relatively low. To help reduce the risk of endometrial cancer, women taking tamoxifen will have regular gynecological checkups and be advised to report any unusual vaginal bleeding or discharge to their doctor. So diarrhea may also be experienced while you're taking tamoxifen. So if you're experiencing diarrhea while taking tamoxifen, it's important to stay hydrated. Diarrhea can cause dehydration, so it's important to drink plenty of fluids. So here are some tips and tricks that may help with the diarrhea, but if it persists, it's very important to speak to your healthcare provider. So water, clear broths and other liquids can help replenish your body's fluids. Eating bland diets and low fibre foods may help. Avoid spicy, fatty or high fibre foods, which can aggravate the diarrhea while you're experiencing diarrhea. And over-the-counter anti-diarrheal medications such as loperamide can help slow down bowel movements and relieve diarrhea. However, it's important to check with your doctor before taking any new medication. If your diarrhea persists or is severe, please contact your treating team for further evaluation and treatment. Some people may experience headaches while they're taking tamoxifen. So headaches can vary in intensity and duration and may be mild or severe. If you're experiencing headaches while taking tamoxifen, it's important to talk to your healthcare provider. They may be able to recommend strategies to manage these symptoms, such as alternative treatments, or refer you for further investigations if necessary. So constipation may be experienced while you're taking tamoxifen, and it's important to stay hydrated and drink plenty of fluids, especially water, to help soften your stools and make them easier to pass. Here are some tips and tricks for managing constipation. However, if it persists or is causing you pain and discomfort, please contact your treating team for further advice. So include fibre-rich foods such as fruit, vegetables and whole grains in your diet. Fibre adds bulk to your stools and may make it easier for it to pass. Regular exercise can help stimulate your digestive system and promote regular bowel movements. Talk to your treating team about using a stool softener, which can help make your stools softer and easier to pass. In more severe cases, your doctor may recommend a laxative to help your constipation. It's important to use laxatives only as directed by your doctor, and it's important to address the issue of constipation as soon as possible to prevent it becoming worse or a more serious issue. And if you are experiencing abdominal pain or blood in your stools or any other concerning symptoms, please seek medical attention immediately, and always discuss this with your doctor if you are concerned regarding constipation. So some people may experience taste changes and loss of appetite while taking tamoxifen. So this medication can cause taste changes, including a metallic or bitter taste in your mouth. This can make it difficult to enjoy food and can affect your appetite. There are a few things that you can try. So try different foods and experiment with different flavors and textures to find foods that are more enjoyable to eat. Use spices and seasonings, as adding spices and herbs and other seasonings may help reduce or mask the unpleasant taste and make food more appealing. Drink plenty of water, stay hydrated. This can help wash away any unpleasant tastes and keep the mouth moist. Some acidic or spicy foods may exacerbate taste changes, and avoiding these may help. And if taste changes are very severe or persist, talk to your doctor. They may recommend other treatments or refer you to a dietitian if necessary for further advice. So some blood tests can be affected while you're taking tamoxifen, and we'll just talk through them quickly. So your liver function should be monitored during this treatment. In some cases, tamoxifen can cause an increase in liver enzymes, which can indicate liver damage. If there is significant increase in liver enzymes, your doctor may reduce the dose of tamoxifen or stop it altogether. The frequency of blood tests will be at the discretion of your treating team. Cholesterol levels may change while you're on tamoxifen. So tamoxifen can cause an increase in low density lipoproteins, also known as LDL cholesterol levels. This is also known as bad cholesterol, and a decrease in high density lipoproteins, also known as HDL cholesterol levels. These are also known as good cholesterol. This can increase the risk of developing heart disease. It's important to monitor cholesterol levels during treatment with tamoxifen. Your doctor may recommend lifestyle changes such as healthy diet and exercise to manage cholesterol levels, and in some cases, cholesterol lowering medication may be necessary. The frequency of blood tests will be decided by your treating team. Having a diagnosis of cancer or being on cancer treatment can increase your risk of developing a blood clot. It's important to be aware of the signs and symptoms of a blood clot, as they can be serious and require prompt medical attention. So just to talk through some of the signs and symptoms of a blood clot, and to be aware, the most common places that you may experience a blood clot are in the arms, in the legs, or in the lungs. So swelling, pain and tenderness, warmth or redness, shortness of breath, chest pain and discomfort, a rapid or irregular heartbeat, sudden onset of severe headache, blurred vision, or dizziness. So just to be aware, blood clots can appear in the arms, legs, and lungs more commonly. However, they can appear in other parts of the body as well. So if you experience any of these symptoms, you need to seek urgent medical attention. A blood clot is classified as serious, but they can be treated with medication, so it's important to seek immediate attention. So ocular toxicity, which is changes to the eyes, can be experienced while taking tamoxifen. So tamoxifen has been associated with ocular toxicity and can include a range of symptoms such as blurred vision, visual field defects, cataracts, and retinopathy. These are generally rare and tend to occur after prolonged use of tamoxifen. It's important to note that not all people who use tamoxifen will experience ocular toxicity, and the risk of developing this condition is generally low. If you are taking tamoxifen and experience any of these changes in your vision, please contact your treating team and speak to them regarding the next steps. They may recommend further evaluation and potentially refer you to an ophthalmologist for further assessment. So another side effect that can be associated with taking tamoxifen is a risk of infection. So leukopenia is a condition in which the body produces fewer white blood cells than normal, which can increase your risk of getting an infection. If you are taking tamoxifen and experience symptoms such as fever, sore throat, or other signs of infection, it's important to contact your treating team immediately. They may be able to perform a blood test to check the level of your white cells in the blood and determine if there's further action needed. So vaginal dryness or bleeding may be associated with taking tamoxifen. Tamoxifen can reduce the amount of estrogen in the body, which can lead to thinning of the vaginal tissues and decrease in natural lubrication, resulting in dryness and discomfort. Additionally, tamoxifen can also cause vaginal bleeding when you start this treatment or change to it from another treatment. If bleeding continues for more than a few days, you need to alert your medical team. Here are some simple tips and tricks for managing vaginal dryness and bleeding. So you can use a non-hormonal based lubricant or gel during sexual activity to increase comfort and reduce irritation. Consider using a non-hormonal based vaginal moisturizer to help restore the moisture to the vaginal tissues. But it's very important to note, if you do experience vaginal dryness or bleeding while taking tamoxifen, it's important to speak to your healthcare provider to determine the cause and discuss possible treatment options. They may also be able to recommend additional strategies to manage your symptoms and to help you feel more comfortable. So hair thinning may be associated with tamoxifen. So tamoxifen works by reducing the production of estrogen in the body, which can affect hair growth and lead to hair thinning. If you experience hair thinning while taking tamoxifen, try to be gentle when washing your hair and brushing your hair. Use a gentle shampoo and a soft bristled brush with a white tooth comb to prevent pulling and damaging your hair. If you are concerned about hair thinning or hair loss while taking tamoxifen, please speak to your treating team. They may be able to provide more treatments or strategies to help manage this side effect. And there's also a podcast available from the Answers for Cancers in the practical resource section within the app with Anne Roach, and she'll be able to discuss some strategies for coping with hair thinning and hair loss. So contraception is important to note while you're taking tamoxifen. So it is not recommended to get pregnant or to make someone pregnant while taking tamoxifen. An effective contraception should be used during this treatment. Breastfeeding is also not recommended. So tamoxifen is not recommended for use during pregnancy or while breastfeeding, as it may be passed on to the nursing baby through the breast milk. Please speak to your team if you have any issues regarding this.
Perfect. And can you just tell us how to take tamoxifen every day?
Yeah, so it is important to take tamoxifen exactly as prescribed by your doctor. Do not stop taking the medication or change the dose without consulting your doctor. If you miss a dose, take it as soon as you remember. If it's close to the time of your next dose, skip the missed dose and continue with your regular dosing schedule. If nausea develops, you can try taking tamoxifen at night instead. And if you vomit after taking tamoxifen, do not repeat the dose. If you have any questions or concerns about taking tamoxifen, please speak to your doctor or pharmacist. They can provide you with more information and help you manage the side effects or interactions with other medications. And finally, it's important to note, this is very rare, but anybody can have an allergic reaction to any medication. So just to point out some signs of an allergic reaction: coughing, wheezing, shortness of breath or difficulty breathing, itchy red skin, digestive discomforts or problems such as diarrhea, swollen eyes, lips and throat, you need to seek urgent attention if any of these occur. But please note, this is very rare.